good if one of us prays and then to let God allow us this moment. At times it's also good to have our hearts spiritually correct.
Thank you, Doctor. Okay.
Yes.
Doctor, can you lead us in a word of prayer?
I was thinking Elder Ondimu could do it for us.
Ondimu, let me see. Ondimu had a problem with the voice.
Okay, I guess I was muted. I'm saying a pattern cannot be passed twice. Now that I've been selected as a second person, I can do it. Let's all pray.
Thank you.
Heavenly Father, we thank you. We thank you for this amazing, marvelous day that you have given us. As we come together to discuss and look at the effects and impacts of COVID-19, we ask that you be with us, provide us with the wisdom, provide us with the guidance, and be with us and protect our people most specifically against all these that is going on out here with the virus of COVID-19. We thank you and pray all these things in Jesus' name.
Amen. Okay. Is Edwin Bogonko in? I'm not sure if Edwin. I'm not.
Yes, I am.
Okay. Thank you. So, thank you very much, Daktari, for reminding us to start with a word of prayer. And as I want to, now that we are all in, first of all, as I said, Grandi is a medical doctor with the Hennepin County Hospital here in Minneapolis, and he's also an assistant professor at the University of Minnesota. Dr. Edwin Bogonko is a medical doctor, has an MBA from Carleton School of Management, and a medical degree from Nairobi University. Currently, he's a physician and a director in Alina Hospital and a chief medical officer for diaspora care. Ellen Kasadi is a church dialysis nurse at Fresnius Kidney Care and Honor of Reason Home Care. And she holds a master's degree in nursing from Grand Canyon University and a bachelor's in nursing from University of Minnesota. Lina Nyamwaya is a registered nurse and works as a nurse in a trauma hospital, holds a Bachelor of Nursing degree from Meadow State University, and currently a graduate student. Also is the president of Nurses Network, executive director of Bold Impact Group. Gerard Ondimu works as a capital markets loan administration manager in one of the banks here in Minneapolis, in the corporate office. Holds a doctor of business administration degree in economics. And we have David Vijanga, a graduate of Carleton School of Management and a sales agent with Remax. I don't know if we have left anybody out. I think, okay, Pastor Lee Kinyaberi, I don't know if he's in. He's the one going to talk about ministry, the impact with ministry, but he's a pastor of
Yes, I'm in.
Central SDA, Central State, United Central SDA Church and Mount of Experience. So I want to welcome both of you in. And just something small, as we are talking about this, everybody knows, and we want to talk about the impact. And because there are many facts, myths, and fallacies out there, so and I would like to start with Dr. Kerandi. Briefly tell us about what is COVID-19, because I know there is a lot of information in the social media, but if you can tell us briefly what it is.
Thank you so much, Dr. Mandy, for giving me the opportunity to say what COVID is. I must admit that COVID is one of the diseases which almost everyone has known, from the 2-year-old to those ones who are very old. I was surprised even my mom knows what COVID is. There is a lot in the media, there is a lot in the medical literature. There is a lot everywhere you go. People are speaking about COVID. COVID, as you are, the letters COVID, as you know, is coronavirus disease 19. This was given by WHO, but we know it started in China. That's when the first case was diagnosed. But the real virus which causes this is called SARS, coronavirus 2. SARS stands for severe respiratory distress syndrome, coronavirus. Coronaviruses have been there for years, but this one seems to have led to an epidemic, then and eventually to a pandemic, causing mostly respiratory disease, but it can affect other organs of the body. So COVID, as it is a virus, like we all know, causing other viruses like HIV, you know about it, you know rhinoviruses, which cause common cold. We have adenoviruses. So it's a virus, but it has risen to be known by almost everybody because it has affected the whole world. And it's very contagious through what we breathe, that is what we inhale, or through contact. So you all know about it, and we will share much. And there is a lot which is coming up. It has been very difficult to filter what you get from the medical literature, what you get through the media, the newspapers, radio, TV. So it's all of us, it's all with us. And so each of us may know something different from what someone knows about COVID. So it's a virus which is called new virus, could have been a mutation which occurred in one of the viruses which had been there before, but which is hard to control at the moment. So that's what I can say in brief. If Dr. Bogongo can also add what he knows about it. Thank you.
Okay, Dr. Bogongo.
Yeah, I think the only thing I can add is that if you remember the SARS virus, you remember the MERS virus. So those are sort of the same class of viruses that are very, very contagious. And what is unique about the coronavirus is that it really causes very severe respiratory illness. And that's why a lot of people are dying from it. I think that it's one of those evolving diseases to the extent that we are learning new things every day. And it's really, really important for people to stay tuned to what science is telling us about the virus, because we are at the moment don't even know what we can use to treat the virus except supportive therapy. And a lot of the treatments we have right now are all experimental, with different groups even discounting the value of some of the treatments that have been touted in the media. So I think the medical fraternity has not essentially been able to agree what is the most effective treatment. And so we're going to learn, I think, together the progress that's being made by different scientists and doctors that are at the front line. So I mean, it's very scary, obviously, for those who are on the front lines. But what we have also learned is that if you follow the simple guidelines of wearing protective equipment and triaging patients so that you can protect yourself and mask appropriately. And now what we are doing at the hospitals is also to make sure all the patients, regardless of whether they have been tested or not, to wear masks. And part of the rationale behind that is that 80 to 85% of coronavirus patients are asymptomatic. So we are more carriers than those that get infected. And so now we are promoting not only social distancing, but universal masking as a way to protect not only caregivers, but also other patients in the hospital. So a very interesting illness, I think, in terms of disease spectrum, but there's a lot we still don't know.
Thank you. Lina Nyamwaya, can you tell us your experiences as a nurse? Can you share your experiences of working with COVID patients?
Is it my turn?
Yes.
Okay. Hi, everybody. So I work in leadership, and of course, I work in the community as a public health nurse. It's good that we have Dr. Kerandi and Dr. Bogonko here to share their kind of treatment and medical plans. But as a nurse, the only thing I would say is that, like they said, there's a lot of information on social media and a lot of information in the public that they can get, but I hope that the meeting was to give the public kind of breakdown of what we are seeing. So initially we heard about shortness of breath and coughing and sneezing and, you know, body aches like malaria, but now we are actually seeing more. I will tell you a friend who just got out of the ICU, they had blood clots on both lungs, they had diarrhea and nausea. The first thing they did is they lost taste, like a sense of taste. So that went away, and then they could not breathe. So I think what maybe the doctors can agree to is that every patient presents differently, and we are seeing everybody responding differently to the virus. Some are mild, like some say the flu or malaria, and then some, the ones who end up intubated, is they can't breathe and it hurts to cough. One girl told me yesterday, the patient, is that it hurts so bad when they cough, they feel like their lungs are being ripped out of their chest. So there's deep coughing, pain with coughing, a lot of unable to take a deep breath, or they're not getting any air. And then blood clots is another thing that a lot of people are complaining about. And maybe the doctors can expound on the strokes that we have a few young people that have come in with strokes as well. So chills, body shaking with chills, headaches, muscle pains, shortness of breath, all of those things. So if you're asking me about symptoms and signs, everybody presents differently. I'm sure since it's new, we are gonna see a lot of new different things as we learn, but that's what we are seeing at the bedside or like at the hospital.
Okay. Thank you very much. I wanted to share something with you about, I don't know if you're able to see something I wanted. Okay. If you are seeing that, and I would like to ask, you can see there. Now, and I wanted to ask our doctors, first, Dr. Kerandi and Bogongo, why is it that on those counties, some of the metro counties here in Minneapolis, you can see Hennepin County leads by far. As of today, there were 3,558 cases and 389 dead. While Ramsey has 920, 45 dead. These are the metro counties. The one in green are outside the metro. Why is it that it's only Hennepin is so high like that?
So if I can go before Bogongo comes in, first of all, realize that Hennepin County is the most populous county in the whole of Minnesota. Mm-hmm. So in that, if you extrapolate, you are going to you have more patients there who are going to be affected. And remember, it's in the metro area where we have quite diverse population. But also, you may be surprised that the disparity of care is more in that county than maybe any other county. And by the fact that there is more populous, the patients who are there may have a lot of comorbidities, meaning other diseases, including diabetes, hypertension, asthma, etc. And you should also realize that wherever there is a high density populated area, the close contact is going to be more than where people are sparsely populated. So the contact is higher, you know, there are more shopping, there are more people getting into contact with each other. And also you have heard that most of the patients who have died in Minnesota have come from nursing homes. And those nursing homes are actually in Hennepin County. The two of them, which are the highest, are in Hennepin County themselves, whereby then, which then means that when the data is going to be taken, you are going to see that numbers reflected in Hennepin County. So in summary, it's the most populous, whereby we have immigrants living in, some who may not have health care, and also there's a lot of disparity of care in that area. Also, you expect to be more contact, and the spread is going to be more. And we also have more nursing homes in Hennepin County than any other county, whereby it has affected most of those patients who have those comorbidities. And one of the risk factor for having severe or developing that is patients who are over 65 years, although it can affect anybody else. So that is what I can say for now. What I think we may have other counties coming in, but they may not pass Hennepin County or Ramsey by the fact that those two counties are the most densely populated in the state. So if Dr. Bowongo can chip in.
Yeah, I think that's spot on, Dr. Kerandi. You know, the data that's coming out of New York suggests that the COVID-19 is actually disproportionately affecting people of color, people in the lower socioeconomic status, and also people who live in highly densely populated areas. So much more difficult to do social distancing and all the preventive or mitigating public health recommendations that have been put by the CDC. And I don't think that we are seeing any different in Minnesota. And you know, Hennepin County is actually one of the top 10 populated counties in the entire country. So it's one of those dynamics I think that's in play, and it's still unclear why even a disease like COVID-19 is affecting people of color more than the general population. So that's I think that's something that is being studied, especially with the experience from New York.
Okay, thank you very much. Helen Kasadi, do you have something to add on that? Ellen? Oh, maybe it's muted. Or?
I think I was muted. I was muted. Okay. I don't have anything to add mostly, but because I work in dialysis, and then in dialysis we have also diversity of populations, and then also, you know, most of the dialysis patients, they have resisting condition. So they are more prone to getting that disease compared to the other people. But the only, I don't know, because I agree with Lena what she said about that every individual that comes with this kind of disease, they have a different symptom. Because what I notify in our, I have taken care of 3 African American COVID positive patients. When they came to the hospital with this disease, they did not have the symptom of respiratory. They did not have, high temperature, but they had a lot of confusions. So I don't know. So as I said, everybody's religion. So it's just difficult to say, because we don't know. Also, also have to understand the social economic of immigrant and most low income people. They do not have their tents in the house. So when even there are too many of them in one home, so they are more higher of getting one person getting it and giving it to other people, to family member, compared to other Caucasian people that have the only two of them in the home. They can space themselves in the home easily compared to us that have 5 children. I have 7 kids in the home. So it's like we all crowded in the home. So that's another thing that really I was mostly thinking that I can add.
Okay. And then that brings me to, if you can see the other graph about Minnesota, as of today, we have total positive cases, 11,271, but the number of healthcare workers is 1,360. What can you say about where we have most of our people from African immigrant? They are working in the healthcare field. What is your take on that number, and what advice can you give? Lena.
Okay, so I think I was muted, but definitely concerning. You probably saw my post yesterday or the day before. I had gone to meet with the mayor of here in New Hope, my city, because St. Therese happens to be only less than a mile from my house. Northridge is less than half a mile from my house. In fact, I used to work at St. Therese. Tonight, I am coming live with the mayor of Brooklyn Park for the same. So there's 2 things. A lot of African immigrants work in healthcare. Number one, it's less discriminatory as long as you have a license as a CNA, as an LPN, as an RN, as a doctor, as a pharmacist, as a housekeeper in the hospitals, we get a job. And I think that's where most of us start. Even the business people here can probably attest that somehow they were touched by healthcare, whether in a group home, a nursing home, or something, as a stepping stone to getting to where they are going. With that, then comes also the other factor of that these healthcare facilities, especially nursing homes and assisted livings, do not pay immigrants as much money. So guess what? They are forced to work not only at Northridge, but also at St. Therese and Maranatha and another place. So guess what? That thing of do not be everywhere doesn't work. You have to be spreading it and infecting each other or being infected as you go. And as immigrants as well, we are communal people. So before the big outbreak of social distancing and stay home recommendations were in place, we still had our gatherings and we still had other things to do. So I think, and Helen said it well, that as immigrants, we don't get the luxury of just living by yourself. We do host our parents, we do host extended families, we do host new immigrants coming from home. And I feel like as a culture, we are not known of our deficits by the world. So it's a good opportunity to share with the governments and officials to let them know where we are. And when these other opportunities come of the emergency support, whether it's loans or whatever breaks that they give, even the stimulus checks, a lot of immigrants that do not have papers do not get that check. So guess what? They must still go to work even when they're sick, even when they don't feel as sick. So then they end up being at work. So if you're asking me why, I can see why a lot of healthcare workers can be infected. The 1,300 healthcare workers are not all immigrants, but majority of them that come from long-term care facilities. Again, it boils down to what Dr. Bogonko says about people of color. We're the essential workers at the bedside, at the clinical facilities. We are the ones providing the services. So yes, it kind of relates or kind of correlates with the story of why there are so many of them affected. Because we don't have a lot of luxury in doing what other people can say, oh, I'll stay at home or something. Immigrant workers have to work.
Okay, thank you.
The only thing I can add, the thing that I can add with what my sister is saying is about this one. I can see like sometimes when I used to work in the nursing home, you see an immigrant and people work 2 jobs. Like she work in the one nursing home and go at night in the other nursing home. And also I believe that most of the nursing home, they were not prepared to have enough equipment to equip all these people, to give them, to protect themselves, taking care of those patients. They did not have those lectures, and they did not have they were not well prepared to give them, personal protective equipment, which is the gloves, the mask, the things like that. So by the time they realized that, okay, this is a problem, it was already too late. Because I remember one of my sister working in one of the nursing home, my younger sister, she was calling me to ask me, hey, sister, do you have any extra masks? Because at whatever nursing home they were working, they did not give them any masks. So that's one of the things that also I don't think like most of the nursing homes and some of the home health care program, they will prepare for this kind of virus and epidemic.
Okay. Anybody who wanted to comment on that, on the same issue?
Yeah. So I think that the most concerning thing about COVID is our community, because we are disproportionately represented in the healthcare field, especially taking care of the highest risk patients, those who are over the age of 65 in nursing homes or in group homes, which means that regardless of whether we know the dynamics that are driving people to keep working, I think we need to send out a message to our community that at some point your health comes first. To declare, there are a lot of people who, because of other pressures, will not want one employer to know that they're working across the street. But in the process, think about what happens. They are going from one healthcare facility to another. They are going back to their children. There are multiple people in the household working in healthcare. And then if one person gets infected, essentially all of them get infected. And we've had stories where an entire household is infected. So I think it's really essential to realize that we're the highest risk population, in my opinion, and we need to put a little bit of a time out to ask, are we protecting each other? If we have to create some community resources for personal protective equipment, whether we have to send out some culturally appropriate education around COVID, I think those things matter. But I do agree with Lena that the reality is that nobody has, at least until recently, made a very concerted effort to identify people of color as highest risk, especially as it relates to those who are undocumented, who are afraid to come out and say, I have this or that symptom, and they cannot get assistance and that sort of thing. So it becomes a matter of survival. But I think it's important, we have to find a way to promote the idea that protect yourself first. If you're healthy, then you can take care of somebody else.
Yeah, I feel compelled to add on top of what they've just said in terms of the contribution of immigrants to the healthcare system. Especially, I'm going to give numbers. I love numbers. And I'm going to give those numbers here. I kind of looked at the numbers now overall in the United States. On the front lines in battling this pandemic are 1.7 million foreign-born medical healthcare workers. 1.7 million foreign-born medical and healthcare workers who are caring for the COVID-19 patients. That's a staggering number. In fact, that's coming from the Census of Bureau of Community Services within the United States. Immigrants compose only 13% of the entire US population. Only 13%. Then hear this number. In 2018, 35.2% of those who are caring for healthcare are foreign-born immigrants, 35.2%. Then listen to this. 28.5 physicians, where Dr. Kerandi and Bogongo fall into, are foreign-born physicians in the US. Remember, they're only 13%, but 28% are foreign-born. Then here, listen to this now. 18% of healthcare diagnosing and treating practitioners are foreign-born, 18%. Look at, those are staggering numbers. 15% of registered nurses are foreign-born, 15% are foreign-born nurses. And 14.9% are healthcare technicians. You can see we are overrepresented, yet we're only a small, tiny percent. So it's very critical that our people know that while we are so small, yet we're in the front lines. In fact, we're the ones holding the guns, fighting this for the rest of the country. Supposedly representing everybody else. Those are the numbers I just wanted to put across.
Thank you for your addition. Anybody
Yes.
wants to comment on that?
Can I comment?
Yeah.
So with exactly the numbers that Dr. Nyachai just shared, Dr. Ondimu, I think it's important to know then what can that translate to? And even with our Zoom meeting today, how does that affect our community? Dr. Bogonko brought up a good point. How then can we serve our community, and how can we resource our community to know that they are supported? That is why we need to be involved in letting the world know, especially the governments from a local level all the way to Congress, that we do matter, like that disproportionate representation that Dr. Ondimu mentioned. We do run the healthcare in this country. And with that, how can then we get all those healthcare workers who don't have the legal papers to work? That's one thing that Office of Ilham Omar is championing right now, work authorization for the legal nurses and doctors that are here, that are facing the front lines and are not known. The other thing that she's also working on is the hazard pay, which is one thing that can really benefit our community. And I think we have a tendency as immigrants to kind of not be involved because we are busy working, and I get that. But also it's good to know that the more we get involved, the more we sign petitions and stuff, the more we actually get what we need from this. Because right now, it doesn't matter if you're an immigrant or an American, we are all fighting COVID. So I think it's important to know what is out there that can be done to support these people that are working in the front lines, because there's a lot of them. Because the moment, if we decided to strike all of us, nobody will be at the front lines. And America is hiring for foreign nurses and foreign doctors to support the system. So there is a lot that can be done from right here in Minnesota to support the hazard pay, the work authorization, and also trying to find a wage support from a local level of these CNAs and techs that work in nursing homes that Dr. Bogonko mentioned. They can't afford not to work 2 jobs because we have a family here and a family abroad. But if you don't tell your mayor, if you don't tell your representative, it doesn't matter. You'll still keep working. So that's why I make it a point of making sure that our communities know what part can we play from our homes to make a change from where we work, because everything is politics. We know that.
Okay, thank you very much.